Since the COVID-19 outbreak began to accelerate in Canada, we know that many of you have questions, a lot of questions about how to keep safe, how to keep your family safe, about what is or what isn't relevant in this situation. So we've been committing time on each show to finding those answers. And joining us again is Dr. Alison McGeer, an infectious disease consultant with Sinai Health System, and another familiar face these days, Dr. Isaac Bogosh, infectious disease specialist at University Health Network. As we've mentioned, lots of questions for you. And Dr. Bogosh, let's begin with you. And let's talk about face masks. Have the guidelines for civilians, ordinary people, using face masks changed?
No, they really haven't. We firmly believe that people in the general public should not really be wearing face masks because it doesn't really provide any additional protection against getting this infection. If someone's infected with the virus, it's very helpful that they wear a face mask to help prevent them from spreading it to other people, but they're not really going to prevent people from getting infected.
Dr. Muir, let's go on to the next question, which is about deliveries. The specific question was about when people get groceries delivered, should they be wiping it down when it comes to their home?
You know, what's more important than wiping it down is cleaning your hands afterwards. So I think, you know, in general, when you've come into contact with something from the outside, another person that you have to come into contact with for some reason, the answer is after that, you should be cleaning your hands. That's more important than wiping it down. Most wiping down doesn't do nearly as much good as getting soap and water or alcohol hand rub on your hands.
A question for both of you, and I'll start with you, Dr. McGeer. In terms of the amount of testing we're doing in this country, is it enough?
You know, we'd all like to be doing more testing. But there's a limit to how much testing we can do because of the supply chain for all the things we need to do testing. You know, we've just asked the people who supply the swabs, the reagents for the testing, the machines, our staff to do many, many more tests in every country around the world simultaneously. And so ramping up production to have as many tests as we like is really, really difficult. So we're trying to make sure that we're doing the tests we need to be doing and not doing the tests we don't need to be doing. And I think people are doing a pretty good job of that. But it does mean that for people who are mildly ill, where they'd like to know the result of the test, and we might also like to know, but it's not going to change what we do. We're saying, bear with us. Can't be tested now. You just need to self-isolate at home.
Dr. Bogosh, you know what? I'm going to skip ahead to a different question now because we're running out of time. I think a lot of people have this one. Somebody wrote in to say that they were visiting the United States. They've come back. They have their 14 days of self-isolation. But during that time period, can they go outside for a walk? Can they take their pet for a walk, or are they stuck inside?
No, you're supposed to stay at your home. That's very clear on the Public Health Agency of Canada webpage what exactly self-isolation means. You're supposed to stay in and around your house. It's not meant to be, you're not meant to be walking down the street or walking your dog. You can stay in your house, and I'm sure you can go outside in front of your house, but you're really supposed to stay around the home for that time.
Lots more questions. We're not going to get to them tonight, but Sunday on the next National, we certainly will pick up where we left off. Thanks to both of you.
Anytime.